The role of cervical mucus in conception. This is the topic of discussion in today's lecture. The role of cervical mucus in conception. Conception means I am talking about pregnancy. To initiate pregnancy, what is the role of cervical mucus? Cervix. This is the lower part of uterus, and its beginning you would find at the end of the vagina. Okay, so this part is known as cervix, and it plays a major role in case of conception or pregnancy. So what happens? What is the role of this cervix? In cervix, there is cervical mucus. It is nothing but a liquid, means fluid, okay, which is thin, clear, and stretchy. It helps the sperm to reach to the uterus as well as to the fallopian tubes. Okay, so that is the role of cervical mucus. Okay, so this role is critical because if the sperm cannot reach to the fallopian tube, then pregnancy or the conception is not possible. So as long as it is healthy, means I am talking about cervical mucus, as long as it remains healthy in nature, it plays its own role. Okay, but certain cases are there where this cervical mucus becomes hostile in nature. Means if it becomes thicker, then in that case sperm cannot swim through that mucus to reach to fallopian tubes. So what happens during the sexual intercourse? Ejaculation occurs inside the vagina. Then the sperm inside the vagina, that sperm reaches to the uterus through the cervix, and in cervix there is cervical mucus. So as long as the cervical mucus remains thick, not thick, it is thin, stretchy and clear, so it becomes easier for the sperm to reach to the fallopian tube. Of course, before fallopian tube, the sperm reaches to the uterus. Fertilization occurs inside the fallopian tube, and that fertilized egg, which is known as zygote, that again comes back to the uterus, and implantation of the zygote or the fertilized eggs occurs inside the uterus. Okay, so this is the procedure of conception. Anyway, so I was talking about cervical mucus. Okay, so as long as it remains in good condition, means in healthy condition, then there is no problem with this cervical mucus. But if it becomes thicker, that means it becomes hostile in nature. So in that case, sperm cannot swim through that mucus to reach to the fallopian tubes. So this is one of the causes behind infertility. Means this is a kind of fertility challenge. Whenever couples plan for their parenthood, okay, they may suffer from this problem. There are actually so many reasons if conception is not occurring. Okay, and out of those reasons, one reason is the problem with cervical mucus. And in this lecture, I am talking about only cervical mucus, the problem with cervical mucus. Tests, how doctors would know there is a problem with cervical mucus. For that purpose, different tests are there. One test is called postcoital test. Means just after the sexual intercourse, the mucus of that female person is tested by doctors. whether it is healthy or not. Okay, whether it is thin, stretchy and clear or not. So doctors examine that cervical mucus just means shortly after the sexual intercourse. That is one kind of test. Next test is the test in the laboratories, means pathology labs. So during the menstrual cycle, at different phases, that mucus, that is cervical mucus, is collected and that is sent to the pathology labs for testing. Again, one more test is there, which is called, which is known as anti-sperm antibody test. Antibodies always remain present in the cervical mucus, but if anti-sperm antibodies remain present, then that antibodies create problem for the conception. Okay, so cervical mucus here, what is the function of cervical mucus? So it is helping in transporting the sperm from vagina to fallopian tubes. This is one function. Next function is cervical mucus. These contain nutrients which sustain the sperm. Again, cervical mucus, if it is in healthy condition, then they can filter out the sperm which are weak in nature. Means cervical mucus filter out weak sperms and allow only the strongest and motile sperm. Okay. Allow means allows to the uterus. Anyway, I am not talking about all that procedure. I am talking about only cervical mucus in this lecture. So tests, different tests are there. Yes, if doctors identify that cervical mucus is the reason behind infertility, then in that case solution is there. One solution is hormonal therapy. Due to the changes in hormone levels, such as I am talking about estrogen and progesterone hormones. Okay, there may be a problem with cervical mucus. So hormonal therapies are there which may improve the level of, means required level. Okay, improve means required level. So that is called hormonal therapy. Okay, which medications are given which can take care of estrogen and progesterone hormones. Then IUI is there, means intrauterine insemination. In case of intrauterine insemination, what is done? Sperm is directly placed in the uterus. Okay, sperm is directly placed over there. Means this procedure bypasses the cervix or the cervical mucus. That is directly placed in the required position. Sperm. Okay, that is called IUI, intrauterine insemination. And if this procedure does not work well, then the last there is one way that is considered as the last condition, last procedure, that is known as IVF, that is in vitro fertilization. In that case, the fertilization is done outside the human body, that is outside that female person. Okay, in the laboratory, fertilization is done after the eggs have fertilized. Then that fertilized eggs are placed inside the uterus, okay. So that is one solution procedure, that is known as IVF or in vitro fertilization. That is also done. Anyway, all these things are done, or all these decisions are taken by fertility experts. Okay. all the fertility experts are gynecologists, but all the gynecologists are not fertility experts or fertility specialists. Okay. Anyway, so to some extent, all the gynecologists can look after such problems. But if you are suffering from extreme level of problems, in that case, fertility specialists are required. Okay. So the topic of discussion was role of cervical mucus in conception. Okay. So problems are there, solutions are also there. Solutions are available. Okay. But first of all, doctors need to identify the problem. For which reason conception is not occurring. Okay. And if cervical mucus is the problem, then there is solution. Hormonal therapy is there, IUI is there, IVF procedure is also there. Okay. All are available. Okay, so this was all about today's topic, the role of cervical mucus in conception or in pregnancy. Okay, so this is the end of this video. Thank you. Thank you for watching this video.